Hey, good morning. I'm Richard Rose. Welcome to Exit 1055 Long Island, your TV 1055 show about all things Long Island. In just a few moments, a controversial mini casino shifted from Nassau to Queens, but will a promised share of the Queens revenue go to Nassau County instead of the debt-laden Nassau OTB? But we begin this morning with the concerns about the Zika virus being spread by mosquitoes. Pregnant women and vacationers heading for warmer climates are all worried because of its link to child defects. TV 1055's Dick Brennan has more.
The mayor toured a health lab and was shown new mosquito traps. The city now says 40 people here are infected with the Zika virus, and 6 of them are pregnant.
No one has been infected in New York City by the Zika virus. The only people who have it here contracted it elsewhere and brought it here.
Zika is particularly dangerous for pregnant women. It can cause fetal deaths and birth defects, and now the concern is the possibility of it spreading here.
This isn't a person-to-person spread, is that the mosquito would bite a New Yorker who'd returned from someplace where they'd acquire Zika infection. That mosquito might then acquire the virus and then bite someone else and give them the virus.
The mosquito spreading Zika is not here in the city, but our mosquitoes are described as a cousin to it. The city will now increase mosquito surveillance and control in order to trap and test the bugs, and it'll also increase human testing and launch a public awareness campaign.
Expenditures we'll be making will be to add 51 new Department of Health workers, and that will include exterminators, inspectors, and lab analysts.
Health experts say Zika can also be spread by unprotected sex, and they want New Yorkers to be careful when traveling abroad.
We recommend that people even consider taking their mosquito repellent with them if they travel, because you may not be confident that you'll be able to find effective repellents when you get where you're going.
Officials on Long Island are also taking action and warning residents to use common sense.
Stay away from areas where mosquitoes are prevalent. It's just not pleasant to have a picnic there anyway. And it's also something that theoretically could transmit other illnesses such as West Nile.
And here now to talk about what our medical community is doing to combat the Zika virus and combat its spread is Dr. Bert Rochelson. He is the Chief of Maternal and Fetal Medicine at the Northwell Health System. And welcome to our show, Doctor.
Happy to be here.
I understand you've already seen a large number of worried moms, pregnant moms, people who've been to the area or are planning to visit that area. Tell me what they're saying to you.
Well, we've certainly seen a lot of women that have traveled to areas where Zika is endemic, and we've gotten a lot of phone calls from women, young couples. They may be pregnant, they may be planning a pregnancy with concerns about a trip they may make.
Now tell us what illnesses it has been linked to. Everybody's heard about the birth defects, but it goes beyond just birth defects. It concerns long-term as well, right?
Well, that's part of the problem. I mean, in my particular area, we're mostly concerned with the effects on the fetus and birth defects, which include microcephaly, which is a small brain, a small head. And there certainly have been neurologic issues identified in both children and adults. But unfortunately, because this is such a new epidemic, the long-term impact on both children and adults is not very clear right now.
Well, we've known about it for decades, right?
That's correct.
But it's new in these populated areas.
Yeah, so I mean, Zika virus was around in the 1940s, and probably before that, but we knew about it then in French Polynesia and Africa. But obviously, our ability to collect data and follow people longitudinally as they get older is limited.
And another unknown somewhat is how long the virus lasts.
Well, that's the most important problem with this. We know how long it lasts in the bloodstream. And most of the time it's out by 7 days, maybe as long as 14 days. However, what we don't know is how long it lasts in the testes, in the seminal fluid. So it's pretty clear what the recommendation should be for women. It's less clear for men who've traveled to those areas.
That's why there's, it being transmitted through sex. That's particularly concerning for a lot of people, and that's why they're saying don't have unprotected sex if you go into areas that tend to be prone to the Zika mosquito.
Right, that's correct. And the real question is how long you have to have protected intercourse with condoms after you've been to an area where Zika is prevalent. And right now, the recommendation is 8 weeks if there's no signs of illness in the male or female, but 6 months if there's been evidence of infection in the male.
Do you expect to see this Zika mosquito come to the U.S.?
Well, I think it's going to happen. The CDC suspects that there will be areas where Zika is going to be identified in the United States. I think that the likelihood that it's going to be prevalent in our area in the Northeast is unlikely to a great degree. There may be isolated cases, but the idea that it's going to be endemic here is not something that they feel is going to happen.
What about in the Southeast? And are they taking any precautions there? Because it would seem to me like they'd be the most vulnerable now.
Yeah, I think that's a good point. If you look at the maps of the two mosquitoes that may carry it, it basically covers the whole Southeast and up close to our area for the two types of mosquitoes. In terms of the precautions they could take, the most important steps that the government can take now is vector control, is really eliminating those mosquitoes that might carry the Zika virus.
Explain what vector control is. That's kind of a technical term that I'm not familiar with.
Well, vector just means what's carrying the infection. In this case, the mosquito is the vector. It carries the infection and bites a human, and it's what you call a blood meal. So the first thing you need to do is vector surveillance. And there are 176 mosquitoes that have been identified. Only 2 of them carry it, and each one of them has a different breeding pattern and therefore different surveillance challenges. So the CDC and the government and local state health organizations are trying to find the best way to do surveillance for these mosquitoes.
Yeah, because we used to put traps for the West Nile virus.
That's correct, but that mosquito breeds in a different way than the Aedes aegypti, which is for the Zika virus, and therefore that type of surveillance trapping won't work.
So that shows you sort of the problem that they're up against, one of the obstacles.
Yes, it is the problem.
And then some of these precautions, people are struggling with them as well. For instance, use pesticide. I mean, people have been almost trained over the last generation to get away from pesticides, right?
Yeah, I think that's a very good point. But in this case, you're weighing really a known and serious risk versus either no risk or an unknown risk. And that's why the CDC and American College of Obstetrician and Society of Maternal Fetal Medicine strongly encourages women who are going to areas like that are either considering a pregnancy or pregnant, that they use DEET, which has not been found to cause anything in the way of birth defects.
And that's numerous studies.
It's numerous studies. As far as we know right now, it's safe to use DEET in pregnancy.
And, you know, again, one unknown risk versus a measured risk, so I guess that's what the recommendation is all about. But now you also have them saying wear, you know, long clothing, cover yourself up, because this mosquito bites during the day. But let's face it, folks are going to these places for fun in the sun.
Well, that's right. And so there are a lot of destination weddings or bachelorette parties, and they're in Puerto Rico or in one of the islands in the Caribbean. And I'm getting 2 or 3 calls a day to ask whether they should go or not.
Well, we saw that the president switched to $500 million for what was going to be used for the Ebola threat, which maybe never materialized as had been feared, although, you know, it's still significant, and asking for quite a bit more from the Congress, which is reluctant to grant. I think as much as $2 billion has been asked for. That's a big number. Why do we need that much money to combat that?
Well, I'm not a money guy, so I can't answer you exactly, but it's...
But I mean, how would it be spent? What would they use it for?
Well, I mean, I think in order to do the vector surveillance, mosquito surveillance, and vector control, it covers a huge amount of area. There's a lot of blood tests to be done on these women. It's expensive.
Well, it's keeping you and all the folks in our medical community quite busy. We appreciate your paying attention to this and dealing with this potential threat. Dr. Bert Rochelson, Chief of Fetal and Maternal Medicine at Northwell Health, thanks for explaining what's being done to try to deal with Zika.